Hello friend, welcome to the channel Pharmacy Dictionary. If you are a student of diploma in pharmacy, if you are a student of degree or bachelor in pharmacy, or you are pursuing your master in any of the branch of pharmacy like pharmacology, etc., then you should ask few questions from yourself. Why are you doing so? Why are you doing diploma, degree or master? What is the basic reason for doing that? If you get the right answer, then this is a scope of your discipline. Same likewise, we can apply this particular concept or question or 9WH with today's topic, that is pharmacology, its scope and importance. What is the meaning of scope? If we are doing something, then we are expecting some result from that particular task. And if you want to apply that particular knowledge in the many discipline of your life or any subject, that is exactly meaning of scope. Means where we can apply that knowledge, how we can apply that knowledge, and how we will get benefit from that knowledge which we have acquired. So this all questions answer is simply known as a scope, and the scope of pharmacology have to be easily understood by basic example from our daily life. First of all, we have to know what is the meaning of pharmacology in just one sentence. Pharmacology is all about study of drug, its effect, its mechanism of action, along with the response of body for that particular drug which you have taken for getting or achieving any desirable effect. That is called pharmacology. And after getting the complete knowledge of pharmacology, its related branches, as we have seen in earlier lecture, this is complete knowledge of pharmacology. Now we have to apply this gathered knowledge for the betterment of pharmacy, for the betterment of society, even for the betterment of our lifestyle only. Let's consider first a scope of pharmacology that says to study the pathophysiology of any disease or any disorder. So first of all, I should explain you the difference between disease and disorder. Although I have already explained in earlier lecture, let me clear it once again. Disease is a condition where you affected just because of any foreign material, foreign agent which is not a part of your body, like microorganism. I am very happy, healthy and well fine today right now, but if I will get infected by some kind of bacteria, I will have some problem like urinary tract infection, like loose motion, like dysentery, like diarrhea or some conjunctivitis, etc., etc. This happen just because of that particular microorganism which is not a part of my body. That is called disease. But if I have some problem just because of disturbance or imbalance between the chemicals of my own body, that may convert it into a problematic step, and that is simply considered as a disorder, like hypertension or diabetes. In case of diabetes, there is reduction in insulin level, or likewise we can say there is elevation of glucose level, and that glucose level is increased just because of abnormality in insulin production, and that is a problem of my own body, not affected by any microorganism. That is disorder. So we have to apply this pathophysiological knowledge for understanding of this particular disease or disorder. Why that disease take place? What is the causes of that disease? What is a physiological process of that particular disorder? What others happen in case of that particular disorder or disease, and what should we do to stop the progression of that disorder or treat that particular disease or that particular infection? So apply all knowledge which you have gathered from pharmacology is simply known as a study of pathophysiology. Now coming to the next point, that is study of pharmacokinetic profile. What is pharmacokinetic? What does body do to the drug is called pharmacokinetic. Suppose I am taking any medicine. That medicine may be of any dosage form, like it is tablet, capsule, injection, ointment, whatever it may be. Let's consider it as a oral dosage form. So oral dosage form example is tablet. I am taking a tablet. The tablet goes through my esophagus, finally reach to the stomach where already some fluid are present. That tablet get disintegrate first. That means breaking of particular tablet in a small particle. After some time that will get completely dissolved, and disappearance of the particle in the fluid present in my GIT, that's called dissolution. After being dissolved, it will move to the small intestine, from where, not exactly, but most of the case from there it get absorbed depending on the pH and acid or base nature of the drug. That will get absorbed from small intestine, and the small intestine it will reach to the blood. That is called systemic circulation. So this is a complete process taking place, and that is taking place inside my body. That is why this is considered or known as the pharmacokinetic. And example of pharmacokinetic include ADME, that is absorption, distribution, absorption, metabolism, and finally excretion of that particular drug from the body after giving some kind of therapeutic effect, or sometimes as such also. This is called pharmacokinetic. But if you do not know about factor affecting pharmacokinetic, then how can you judge that a particular drug will give you effect, desirable effect, undesirable effect, what will be the effect in some time, what will be the effect after few months? That you have to know from the pharmacokinetic profile also. If for example, if some person is having kidney problem, then how the drug will affect that particular person, how the drug get eliminated by the kidney. If someone is having liver problem, that's called hepatotoxicity problem or hepatic failure, then how the metabolism of drug take place. If someone is having problem in absorption in small intestines, having some kind of colon ulcer, whatever other problem is there, then how absorption of drug will be affected. So studying all these phenomena, how, why, when, where, all this 9WH is called pharmacokinetic profile, and that can only be possible after gathering a complete knowledge of pharmacology. So if you have knowledge of pharmacology, then you can apply this knowledge for the study of pharmacokinetic parameter as a research scientist in the research and development field. Likewise, the next scope of pharmacology says to study the pharmacodynamic profile, and that is important than pharmacokinetic. I cannot compare it, but it is important than pharmacokinetic because we are taking drug to achieve some kind of effect. Now I have to explain again, effect does not mean only desirable effect. There is no such medicament available in the whole world which is 100% safe and having 0% any unwanted effect. There is no such medicine except some kind of or usual nutraceuticals, but that is also included some dangerous category. So let me clear it once again. Any drug which is taken by us is for having some kind of desirable activity. If I am having hypertension, I will take some kind of ACE inhibitor, angiotensin receptor blocker, etc., etc., telmisartan, vasodilator, etc. All these drugs are used to prevent the elevation of blood pressure and to maintain my blood pressure on a normal value, and that particular effect was given by the drug. As per the definition of pharmacodynamic, what does drug do to the body? So that antihypertensive drug reduce my elevated body blood pressure and maintain it up to the normal level. But in some circumstances, that may reduce the blood pressure also from or below the normal blood pressure level, and that is called hypotension. Some beta blocker having a serious effect, that is called impotency. They may cause erectile dysfunction, and that may lead to infertility also. So these two effects, either desirable, which is reducing my blood pressure level, or which is undesirable or unwanted or toxic or fatal, that is some kind of side effect like hypotension or infertility, that all are associated with the drug. To study about this parameter is simply known as a pharmacodynamic, and if you know the effect of drug, if you know the unwanted effect of drug, if you know the toxic level of that particular drug, then you can apply it in clinical pharmacy. 500 mg of paracetamol is considered safe. If you take this 4 tablets in a day, this is considered as a safe. You know it just because of this pharmacokinetic and pharmacodynamic parameter only after the study of complete pharmacology. Then you are a well-known position that if any person take more than 10 or 20 tablets of paracetamol, that may be toxic, that may be hepatotoxic for that particular person, and you have gathered this knowledge only because after studying of pharmacology. Now coming to the next scope, that is clinical pharmacology and therapeutics. In clinical pharmacology and therapeutics, we have to study about the use, their contraindication, posology, and bioavailability of that particular drug in which you are interested. Now what is the meaning of clinical pharmacology? I have explained you in an earlier video. Clinical pharmacology means application of that knowledge for the therapeutic point of view. And therapy include uses. What is the use of that particular drug? You know it very well that minoxidil is example of antihypertensive drug. It will reduce your hypertensive level with help of some other adjuvant, but its side effect is excess growing of hair in female. So if you are getting advantage, you are also getting some disadvantage. But if you have a knowledge, you have a knowledge about the particular drug, its effect, its side effect, then you can apply this side effect as a therapeutic value also. Because if minoxidil is causing hair growth in female, then you can use it as a hair growth supplement, you can use there at all. So this is example. If you are taking beta blocker, non-selective beta blocker, then it may reduce your hypertension, but simultaneously if patient is having from asthma, that may cause problem for that asthmatic patient. So these knowledge are very important. There are so many examples which we will see one by one, lecture by lecture. Coming to the next parameter of this condition, that is contraindication. Contraindication means a condition or situation where we have not to use that particular drug which you are talking about. Like if some person is having kidney problem, renal failure, then he or she should not take diuretic. If someone is having liver problem, serious liver cirrhosis, fatty liver, or whatever any other problem of liver, then he should not or she should not consume any hepatotoxic drug like paracetamol, NSAID, etc. If someone is having from peptic ulcer, he should not use NSAID. Likewise, this is application of knowledge of pharmacology for the prevention, and that is called contraindication. These two things are not to be taken sidewise. Likewise, next is a posology. Posology means calculation of dose. See, dose is very important. If dose is proper, if dose is optimal, that is considered as a drug. But if the dose get increased from the normal level, that may convert into a poison or toxic, and that we'll have to study under the toxicology. So dose calculation is very important, and people are categorized into three main categories: children, adult, and older people, geriatric people. So pediatric, adult, and geriatric patient will not receive the same drug, same quantity for same issue. The drug's dose has to be calculated, and to calculate that dose, we have to use different formula like Young formula, Dilling formula, and that calculation is simply known as a posology. Now next word, but important word, is bioavailability. The rate and extent of drug absorbed from its dosage form that reach the systemic circulation, that means blood, is called bioavailability. Any of the route except IV is not having 100% bioavailability. If we are taking some drug by oral route, that will not give 100% bioavailability. But if you are injecting some drug directly into the intravenous route, that will give 100% bioavailability. Now let me explain bioavailability in a simple way. Whatever drug you are taking, and from that drug, which amount of drug is reaching to the blood and giving its effect, is considered as a bioavailability. Bioavailability of oral route will be lesser than 100% because there are so many factors which affect the bioavailability of drug if we taken that particular drug by oral route, like first pass metabolism, like absorption of factor which we have taken as a food. So there will be so many factors which we will study in the later classes. Coming to the next scope of pharmacology, that is toxicology. We have already studied about the toxicology in our main channel, that is Solution Pharmacy, that is in Hindi. So if you want to grasp that particular knowledge or series in Hindi, please go through that channel, that is Solution Pharmacy. Toxicology means to study about the poison. What is poison? Any chemical agent which may affect the normal physiological process of your body and make you sick or make you a dangerous condition is called poison. So what is the source of poison? From where we have introduced that poison in your body? It may either accidentally or it may intentionally, as in case of suicidal cases. So if some farmer is having plant in his field, he will apply some pesticide, some fertilizer, some insecticide, and there is chances to be infected by that particular poison. So these are the source. After getting affected by that poison, how our body will try to explain that I have problem of this particular drug, like blue nails color or eyes color, pinpoint pupin, opioid poisoning, or any other poisoning. So what are the basic symptoms by which we can identify that particular person is having some kind of poisonous in his or her body? These are called symptoms. Now third one is management. Management is not exactly treatment. Management means to manage that particular state of well-being. If someone is having problem of poison, then we have to make it stable, avail him oxygen supply. Gesture posture should be uniform. The maintenance start from the identification of poison or identification of particular person that he has taken a poison till that time where it reached to the hospitalization. This is called management. And after confirmation, after identification that particular poison, we have to give antidote, that is considered under the treatment. Like if someone has taken morphine, we have to give naloxone. If someone has taken methanol as a poisonous drug, we have to give ethanol to antidote of that particular drug. If someone has taken anticoagulant, then we have to give some coagulant drug to reduce that particular problem. Likewise, this is called treatment. Now next is forensic science. In case of forensic science, we have to gather the all particular information which give or which can be used as a proof. Like if someone has taken some poison, chahe it may be atropine poisoning or another type of poisoning or heavy metal poisoning, arsenic poisoning, lead poisoning, mercury poisoning, cyanide poisoning, then by utilizing this forensic knowledge with the help of pharmacology in receptor level, in cellular level, in blood component, we can apply that knowledge, that applying which symptom persists, how much time it took to give its unwanted effect, like serum culture, like different type of serum culture we can do that, how level of blood, how level of drug available in that particular case. So there are so many techniques which can be used for the identification of particular poison or any other suspected material in any particular field, in particular patient's body. Now next one is pharmacovigilance. This is nowadays a hero of pharmacology. Pharmacovigilance is made up of two words. Pharmakon, that is obviously drug, and vigilance means the forecasting. So if any drug passes clinical trial for phase 4, that is called post-marketing clinical trial, after reaching to the market, after coming to the population, we have to continuously study about its effect. Most importantly is unwanted effect. Is it safe? It is having any kind of side effect or producing any other type of unwanted effect. To gather such kind of information, there is a scheme, there is a subject, there is a division, there is a working going on that is called pharmacovigilance. A register must be available with every physician so that if physician get any problem by the prescription of any drug for any particular person, he or she may report his problem on that particular register. After a frequent interval, say 1 month, 2 month, 3 month, 4 month or 6 months, that register must go to the district hospital for the district point of view, and that may move on further. So collection of complete detail about the unwanted or problematic effect of drug after launching it in a phase 4 clinical trial, that is called pharmacovigilance. It is the important practice nowadays. It includes allergic reaction. If someone is having allergic reaction by this drug, that should be reported. If someone is having teratogenic effect, that has to be reported. Now what is the meaning of teratogenic? You are new in pharmacology, that I have to explain this word. Teratogenicity is ability of any drug which can cause abnormality in development of fetus inside the womb. That's called teratogenicity, and teratogen is those agent which is having ability to cause that particular problem inside the womb of mother to affect the development of any fetus. This is called teratogen and teratogenicity. Likewise, renal failure. If some drug is available in the market and by utilizing that drug, if anyone or many of the people having problem in their renal function, that may be reported as a renal failure. Likewise, hepatotoxicity or hepatic failure. If some drug is having such kind of activity that is affecting the normal metabolic process or liver function of that particular person, that has to be reported. And all these reporting parameters are included under the pharmacovigilance. Now next one is preclinical trial. Please pay attention on this word. There is preclinical trial. Preclinical trial means any drug which is about to come into the market has to go for the clinical trial, and before going to the clinical trial it must pass preclinical trial. So a trial which is being taken place before the clinical trial is simply known as the preclinical trial. And in preclinical trial we use experimental animal. Experimental animal selection is not an easy job. We have to select the suitable experimental animal for the activity of any drug. Suppose you have studied in pharmacology practical point of view. If you want to evaluate the antipyretic activity of paracetamol or any other drug, then you have to use rabbit as an experimental animal. If you are going to study the histamine effect or antihistaminic effect, then you have to go for the guinea pig. Likewise, the selection of experimental is very important. And once you have selected the experimental animal, you have to go for the toxicity study in mice. You have to go for the activity, a standard activity, protocol manner activity. You have to give a proper dose, proper route, and to study the effect of that particular drug with compared to the standard one or reference one. So that only you can conclude that is that drug is safe or not. If you found that drug safe and satisfactory, then you have to go for the clinical trial after taking proper permission with your authority. In clinical trial, now next one is in clinical trial, we have to use human volunteer, and we cannot collect human volunteer as such. We have to take proper permission. We have to make a proper assignment. We have to make proper agreement with that particular person that he or she is agreed to perform experiment on himself or herself, so that you may start a clinical trial with so many other formalities, which is not a part of our today's topic. So in clinical trial, you have to select human volunteer, and human volunteer may be of two types. In early stage, you have to take the safety, not efficacy, only safety. So you have to take healthy human volunteer. Then after safety measurement, you have to go for the efficacy, and for that you have to take a person who is affected from that particular problem, a disease or disorder, for which you are going to develop a medicine. That is called clinical trial. After the passing clinical trial, that drug will reach to the market. As nowadays you are listening it from your news line that this particular vaccine is approved for coronavirus, this is not approved for coronavirus, this is having some kind of seriousness problem, rashes, allergy, and etc, etc. So this is called pre-clinical trial. Now next one is P drug. This is new concept, that's called personal drug. So what is the meaning of personal drug? Paracetamol is common for all. If me, if you, if my family or any of our population is having fever, he or she will take paracetamol. For all, paracetamol 500 mg. There is no other drug except for this 500 mg. 650 is available, and I'm not talking about that. 500 mg you have to take it. But if your body requires just 100 mg, then you have to take 500 mg. So 400 mg is not useful for you. That may be stored and that may be problematic. If you need 100 mg, then why you are taking 500 mg? Why you are taking 400 mg as a extra dose? Because you have no any other option. But it is in the theoretical process only. This is this kind of hypothetical value which is working or going on this topic. So I have to decide what a suitable mg of that particular drug that should be given to that particular drug. And for deciding this amount, a genomic sequence, a structure of DNA, genetic profile will help me out. Like as I said, pharmacogenomics. So that concept of personal drug, that is P drug, comes from that particular pharmacogenomics point. The last one is new drug development. This is a vast topic. New drug development means there are so many drugs which are under developing conditions. There are so many drugs which are about to release in the market. There are so many drugs which paperwork is going on. So some has taken birth, some has to be taken birth, or some is already available in the market. So how any drug comes to the market is called drug development. And to bring any drug as any molecule into the market, it takes so many times, starting from its chemical structure, starting from its solubility study, starting from its preclinical trial, its clinical trial, different approval process, their suitability, and many other things. So after getting the complete knowledge of pharmacology and its allied branch like pharmacogenetics, pharmacogenomics, pharmacognostic, pharmacotherapeutics, clinical pharmacology, toxicology, chemotherapy, all this knowledge are simply included in pharmacology. So utilizing this knowledge for the development of society, for the development of new drug, is simply considered as a scope of pharmacology. So friend, that's all for the day. Thank you very much for watching this video. If you want to take a screenshot of this whiteboard, I will get away from this whiteboard after some time. Then you may have a screenshot of this. Thank you so much, and please do comment as a feedback in comment box. I will be very happy to read your feedback as your suggestion. Thank you.